Penny just complained of having a sore throat, and it lasted a couple days, and it still didn't get better. And so we were starting to get concerned, and she took a couple trips to emergency care, and there was no strep, so we were like, okay, it's just a sore throat. But we did go see an ENT doctor at Augusta Medical, and he's the one that saw that there was something major going on. She had infection in her larynx, and it was all swollen, and he wanted to admit her, and I was like, are you gonna be admitted? Because I couldn't believe she would say yes right away, but she was sick enough that she knew something was wrong. So they did that, and they took some tests and did some tests and realized it was something really serious. So we bumped her up to ICU, and the next thing I know, they were saying she needed surgery. He said, well, we'd like to send you to Roanoke Memorial. And we said, okay, whatever we need to do, we'll do. So she got flown to Roanoke, and they had a ENT surgical team waiting for her, and they did some surgery on her. And Dr. Magdich was her ENT doctor that did her first surgery, and his team was great. I mean, the physician's assistant was there a lot and helped explain things, and it ended up being that wasn't enough. I mean, they first cut her neck open where the initial infection was, and I guess they waited a few days after that and knew that there was more going on. So that's when we met Dr. Arnold, and he is a thoracic surgeon, and he said that he needed to go down deeper and did chest surgery. He knew that's what she needed. That ended up being a very major thing, because after it was over and he told me, he said, I don't know, she's had heart surgery before, I don't even know if this is gonna be successful or not. I mean, he was very frank about it, but also, very professional, and just, we don't know, but we're gonna do our best to get this infection out. It was very iffy there for a long time with that bacteria, whether she was really gonna make it through or not. But the nurses were great. They came in and, greeted them every day, and, if you want something to drink, they were just awesome. I mean, I couldn't have asked for more. And the care that they gave Penny was just, it was just awesome. I mean, every day they treated me like their friend, and it was just, I couldn't have asked for more, because I was by myself, because Penny couldn't, she wasn't been able to communicate at all. The doctors were, of course, very important in their skills is in surgery, trying to get rid of this, but the care that happens in between all that is just, they had to pay attention to everything that was going on. I mean, she had a fever almost the whole time, and it was up and down, and her blood pressure was up and down. And Dr. Arnold's team, I mean, we couldn't ask for more. He was there, explaining everything, and he seemed to be happy after the surgery that he had gotten the infection, and it was just a matter of time to see how her body was going to react and fight that. And when Penny did get awake and was awake enough for a few days, they were starting to work on her movement and sitting up and stuff she hadn't done for weeks. So the curtains were drawn, and I waited out in the hall, and when they invited me into the room, Penny was sitting in a chair, which is the first time that she had gotten up, and it was probably 6 weeks, or at least 5 or 6 weeks. I just started crying. I was so happy that, she was at that point where she could actually move on her own some.
The one thing I remember is I told Barbara I wanted to go home, and she says you can't walk. And I'm like, oh, you watch this. And I fell on the floor.
Is there a back door here? She was kind of whispering, and I'm like, I was like kind of foggy going, what? I said, yeah, I'm sure there is. What are you getting at? And she was like, let's go. I'll get my shoes on. You're going to take me out.
It's kind of hard for me to believe what I went through. I mean, I believe it, but I guess it's cool. I'm here. I almost walked 10,000 steps a day. Yeah. Went back to work full-time December.
I mean, there's just a whole list of people that were just above and beyond, I feel like, their own job. And it's because they brought them into the picture, you know, themselves are there every day and they see people and they made me feel special. I mean, they made me feel like that I was there, I was doing an important job, and I every day I didn't mind going. It was like going to see my friends every day. So it really was, it was a very positive experience for us, I guess, because we had a very good outcome and just very grateful for Roanoke.